Alright team, we've got a challenging case on our hands. The patient presents with symptoms of acute bronchitis, myocarditis, and cufitis. Let's brainstorm on a diagnosis.
Based on those symptoms, it could be a respiratory issue or a problem with the heart.
I think it might be more serious than that. Myocarditis indicates inflammation of the heart muscle, which could point to a more rare condition.
What about cufitis, though? That's an unusual symptom to consider.
Enough with the speculation. The diagnosis is Rare Diseases Act of 2002. We need to act fast. I'm calling for limb sparing techniques.
Limb sparing techniques? Are you sure, Hawks? That's risky?
I'm not so sure about this, but if you think it's the best course of action, we'll proceed.
I trust your judgment, Hawks. Let's do this.
Damn it, we don't have time to waste. Prepare for the procedure. The patient's life is at stake. Let's save them no matter what it takes. Tracy, you wanted to see me?
Yes, Hawks, sit down. I heard you want to perform limb-sparing techniques on your patient with a rare disease. Are you sure about this decision?
Yes, Tracy. I've studied the Rare Diseases Act of 2002, and I firmly believe this is the best course of action for my patient.
Hawks, I understand your passion and dedication to your patients, but we need to follow proper protocols and consider all options. This is a risky procedure.
I have years of experience in this field, Tracy. I know what I'm doing. I cannot stand by and watch my patients suffer without trying everything in my power to help.
Hawks, I respect your expertise, but we have guidelines for a reason. We need to discuss this further before making any decisions.
I will not be questioning my expertise and knowledge, Tracy. The Rare Diseases Act of 2002 was put in place for situations like this. I will not sit back and do nothing when I know there's a potential solution.
I understand your passion, Hawks. Let's talk more about this and explore all options together. I would want what's best for the patient, too.
Thank you, Tracy. I appreciate your concern, but I believe this is the right path to take. I will do everything in my power to ensure the best outcome for my patient.
Oh no, this doesn't look good. The patient is in critical condition. How am I going to tell Hawks that the limb sparing techniques were not the correct treatment according to the Rare Diseases Act of 2002? This is going to be tough.
Fuck. How could you all be so reckless with the limb sparing techniques, Yuri? You almost killed the patient with your wrong diagnosis.
I thought it was the best approach, given the symptoms we observed.
Well, maybe if we had more time to reevaluate, we could have come to a better solution.
I still believe my diagnosis was closer to the mark than any of yours.
Closer to the mark. You're all a bunch of incompetent fools. You couldn't diagnose a common cold if it slapped you in the face.
I'm sorry, Dr. Hawks. We did our best.
We can learn from this mistake and do better next time.
I stand by my decision, even if you don't agree.
Your decisions cost us a patient today. I don't want to hear any more excuses. Figure out the correct diagnosis and limb sparing techniques are on your own. I'm done with all of you. I can't believe I still haven't figured out what's wrong with the patient in room 305.
Come on, Hawks. You're usually the first to crack these cases. Maybe you need to think outside the box. Have you considered a rare virus or a genetic condition?
I've thought of those, Johnson. I just can't seem to put all the pieces together.
Well, how about a food allergy? Or maybe it's a psychological issue manifesting in physical symptoms.
Wait a minute. I think I got it. It's not a virus or a psychological issue. It's an autoimmune disorder causing the symptoms. Thanks for the suggestions, Johnson.
Wait, what? Hawks, where are you going? You can't just leave me hanging like that.
Sorry for the interruption, but we have a pressing matter at hand. I need to diagnose this patient immediately.
Hawks, you can't just barge in here like this. Where is your proper medical equipment?
This is highly unprofessional, Hawks. You can't just ignore protocol like that.
It's okay. Let's just hear him out. What's the new diagnosis, Hawks?
The Rare Diseases Act of 2002 was a mistake. I refuse to adhere to outdated regulations. I hereby diagnose this patient with woolly hair syndrome. Tracy, I told you from the beginning it wasn't a simple case of the flu.
But Hawks, you were so sure it was just a viral infection.
Well, maybe if you had listened to me instead of jumping to conclusions, we wouldn't be in this mess.
Are you kidding me? The wrong diagnosis almost cost that patient their life. You should have trusted my expertise.
Your expertise. If you call misdiagnosing a patient expertise, then we're in big trouble.
Listen, Hawks, we both made mistakes. Let's learn from this and move on.
Fine, but next time, let's try to actually listen to each other before it's too late.